A non-communicable disease, or what we call it NCD, is mainly not infectious disease. That means you cannot get it from a bug or bacteria. Those diseases caused by genetic or lifestyle factors. There are four major groups of disease which contribute to NCDs. Those are heart, lung, cancer, and diabetic diseases, which contribute to the majority of deaths in the world. People get those diseases simply due to poor diet, lack of exercise, alcohol, and smoking intake. Those contribute to more than 100,000 deaths every day. The burden of NCDs is really high, especially in poor countries. If a family member got a cancer or heart problem, then this affects all the family. Usually that person be detected very late, and the treatment is very costly. In many countries they don't have insurance, and this will affect directly on his family or her family, including the education, the immunization for children, and the proper diet for the family. The solution is very simple. More exercise, reduce consumption of alcohol, no smoking, balanced diet, less intake of salt. Those are among the best buys to prevent non-communicable diseases. The control of non-communicable diseases starts at the community level and individual level. And thanks to our volunteers network, we are there. We have access to individuals, we have access to community and households. Here, the national societies play a vital role to complement the government efforts on non-communicable diseases. Our main objective is to raise awareness, so people are aware about the problem and they know how to protect themselves and their families from non-communicable diseases. National societies have a long history of implementing community-based health programming. There are more than 72 national societies all over the world implementing community health prevention programs using what we call community-based health and first aid, CBHFA approach. This approach uses a simple tool which community volunteers can adapt to their local context, and they can address key priority issues and help the communities to be in charge of their own development and to be part of the solution. Some of those national societies, for example, Sri Lanka, Tuvalu, Cook Island, Ecuador, and others, already integrating NCDs in their ongoing community health programming. And also, national society are addressing NCDs during emergencies. For example, what happened in Japan, earthquake lately, and how Japanese Red Cross integrated or took in consideration non-communicable diseases in their efforts to respond to the disaster. Many national societies are taking the control of NCDs very seriously, but we really hope that all national societies, especially where there is a big burden of NCDs, will integrate non-communicable diseases in their ongoing programming and will focus on this area. No single actor can address non-communicable diseases alone. We need to work in partnership with government, with donors, academia, civil societies, and private sector to be able to work together to address non-communicable diseases in a complementary way.